Hello, my name is Talisa Ramirez. I am going to be doing the BSN 206 dressing change video. I have on my badge appropriate scrubs. For the sake of this, for the purpose of this video, I am going to remove my badge because I do not want it dangling over the wound or the sterile field. So I'm going to take off the badge. A couple of things I do want to let you guys know. I only have one bandage, one Tegaderm, one ChloroPrep, one gauze. So a couple of things will be getting reused because I only have one. The Tegaderm and the bandage will not be applied directly to the skin because I only have one. So for remediation purposes, I might have to reuse it. So okay, so what I'm going to do is knock on the door, perform patient privacy, perform hand hygiene. Hi, my name is Talisa Ramirez. I'm going to be your nurse today. Can you tell me your name and date of birth? Okay. Well, hi, Mr. Jones. Like I said, my name is Talisa. I'm going to be your nurse today. So what we're going to be doing is changing your old dressing into a new dressing. Is that okay? Okay. A couple of things I do want to let you know. Please do not touch anything, any of my equipment. Please do not touch your wound. We have to maintain a sterile field, so that means no touching anything. Okay, so I am going to put on my gloves. We are going to remove the old bandage, but we're going to go parallel to the wound and with the grain of hair. We're going to hold the skin taut and go parallel to the wound. And we're going to put that in the biohazard bag. We are going to take off these gloves. Put that in the biohazard. Perform hand hygiene. Now we're going to open up our sterile kit. It has been open for previous use, but I'm going to open up our kit. We're going to pull out our sterile gloves. I'm going to open up the gloves. Okay, yeah, you can see. Okay, so we're going to pinch your fingers and we're going to put on the dominant hand. Do the non-dominant hand, put in the 4 fingers under the cuff, picking up the glove, placing in my non-dominant hand. Okay. So now we're going to have a clean hand and a dirty hand. So with the clean hand, I'm going to get the ChloroPrep and drop it into my hand. So we're going to get the ChloroPrep. Drop it into my hand. We're gonna go inside to outside. Normally we would toss this in the biohazard, but I only have one, so we have to repeat the step. Inside to outside. Toss it into the biohazard. Then we want to dry the wound. So we're gonna get our gauze, drop it into the hand. And we're gonna pat dry, inside to outside. I would toss this as well, but I only have one, so I have to reuse it. Inside to outside. Trash. Okay, so now we're going to assess the wound with our still sterile hand. We're looking for edema. So no edema, no foul odor, granulation. It looks like the wound is healing properly. Okay, so we're gonna put on our Tegaderm. I'm gonna need both hands for this. I'm gonna pick it up with my hand. Place it on top, making sure it is fitting securely. You remove the paper, initial, date, time. Okay, so now that we are done with that, we are going to put our items into the biohazard bag. So we are going to start with this into the biohazard bag. This into the biohazard bag. Then we're gonna remove our gloves. Into the biohazard. Then we're going to perform hand hygiene and document the procedure. You're in a comfortable position. Okay, your call light is beside you. Do you need anything, Mr. Jones? Okay, all right, that is it.